Well, hey everybody, I'm Joel Arnold. I work here at Communities First. I'm here with my dad,
Hi.
Gary.
Yep, Gary Arnold. Hi.
And Dad, this month, we're doing a lot of work here talking to folks about the importance of health screening and how it can impact quality of life, how long we're around for our families and our friends. So I wonder if you could tell me a little bit about your own experience with the importance of health screening and things that's made you aware of in your own health.
Yes, I think so. I'm a colon cancer survivor. About 10 years ago, I went and had a colonoscopy, and that's when they discovered that I had colon cancer. As far as the screening, I should have had screening before. So what I did was I did it because I had a history of colon cancer, and that's when they found a stage or a level stage 2 cancer, and that's when they removed it.
Yeah.
As far as I should have done was had screening before then. I waited till I was 52. I probably should have had it done before then.
Yeah, it's easier said than done.
Right, but your mom, my wife, pushed me into getting it earlier than what I actually thought I needed it.
Yeah, women are always right.
Yes.
What you should take out of
So that's when I discovered that I had
Nice.
the cancer.
Well, and so that screening, when that happened, was it like pretty far? Did you have any symptoms in advance of that?
I did not have any symptoms.
Okay.
I had it because it was time for me to have one, and with my family history, I thought I better have one, so I went in with colonoscopy, and that's when they discovered what I had.
So let's say if you hadn't had that screening, right? If you would have just kind of kept going, I feel fine, I'm all right, I don't need it. I mean, what?
It could have been much worse.
Yeah.
If I would have waited another year, who knows? Because it was I don't know the mass size, but it was a good sized tumor in my colon.
Yeah.
If I would have waited another 6 months, another year, the outcome could have been quite a bit different.
Yeah. And what wound up happening? What kind of treatment did you wind up needing after?
Well, luckily, so I went in, and I still remember they put a form in front of me, and they said there's 3 outcomes that can come to your surgery. You can have a colonoscopy bag permanently, a colonoscopy bag temporarily, or no colonoscopy.
Yeah.
So after the surgery, luckily, I didn't need one.
Yeah.
But I'm afraid if I would have waited any longer before I had the surgery, the tumor would have grown in size, and the outcome would have been different.
Yeah.
Good chance I probably would have survived, but I might have had a permanent colonoscopy bag.
Yeah, hanging off the side.
Right, going from that stage forward,
because
it would have been larger, and they would have had to take out more because it was close. It was close to the rectum, so they would have had to take part of that out too. Yeah. So.
Well, I think that's the stuff we're trying to talk about this month too, right? Is this sort of like you didn't have any symptoms and there wasn't anything wrong, because we're going to see so many people that like, oh, I feel fine, I don't need to go to the doctor, I feel I'm all right, I don't need this, right? But like when you go and you do a screening like that,
absolutely. If like I said, if I would have put it off, I think the outcome. I don't know, obviously, but I'm pretty sure the outcome would have been quite a bit different.
Yeah. Well, and I can say even, for my own life, whether it's me or I have 2 brothers, right? You have 2 sons. And one thing that we all now do every year, I'm only 30, and I do not a colonoscopy every year, but additional screenings, knowing that we have this additional level of risk in our family. And it's one thing that we want to just highlight in all these videos is the importance of not waiting until you have symptoms or feel bad, because oftentimes, especially when it comes to cancers, once you have symptoms, it's already advanced.
Correct.
So you don't want to be waiting until you feel bad to check in on stuff.
And with the availability of screening nowadays, it's so much easier than what it used to be.
Yeah.
That certainly encourage anybody to get screening as soon as possible.
Yeah.
I mean, don't wait till you're 50, 52 like me. Get it when you're 40.
Yeah.
35, whatever.
Yeah. No, and that's the thing. And whether, you have like organizations out there that have generic fit tests, places like Colorectal, all these other kind of organizations that do this sort of screening.
Yes.
I can speak for myself, right? My doctor will give me like a packet once a year at my physical. I don't have to do any procedure or anything. You essentially take samples and send it in. It couldn't be more easy. It's a way to check in regularly so that you don't get caught later in life being surprised by something.
I got very lucky.
Yeah.
And I think if those easier screening methods were available to me when I was 30, 35, 40, I would have done it because of my family history.
Yeah. Yeah, a colonoscopy is not a fun thing. I know a lot of
No,
people try
no,
and avoid it. That's good.
Right.
Well, is there anything else you want us to know just about like your experience or your thoughts on just the importance of screening or
Well, yeah, definitely get the screening. Like I said, it could have been a lot worse. I ended up having the surgery in January 2014 when we had the snowstorm. I don't know if you remember the snowstorm.
Oh, yeah,
We had like
that.
18 inches of snow. I had to go to Hurley Hospital on Saturday. We got up. We couldn't get out. So I had to call a friend of mine, John Krucher. He came with his pickup truck, 4-wheel drive, took me to the hospital. So I'm there all weekend.
Yeah.
It's snowing all weekend.
Uh-huh.
They prep me Monday morning. I'm down there pre-op.
Yeah.
The nurse comes down and says, "We don't think the doctor can make it in." I go,
Oh, jeez.
no, are you kidding?
God.
But we'll give him some more time. About
Yeah.
a half hour later, she came in. She says, "He's here. Let's go."
All right.
And then that was the start of it.
Yeah.
So it's quite a story there about how the whole thing happened.
That's wild. Yeah, I remember that storm. And there was a ton of. I remember my apartment losing power for like a week and
Mhm.
everything freezing over.
Yeah. Yep.
Man. Well, I think we appreciate you coming in today and talking about this. I know
Sure.
sometimes it's not totally comfortable to talk about health histories.
That's fine.
Again, I can say as a younger person that it's important to get screenings, even if you're in your 20s or 30s or
Yes.
40s and you think you're fine. Just do it.
How easy it is now. There's no reason not to get screened.
Yep.
There's no reason at all.
And you don't know how many people are impacted by that. Again, if you would have waited another 5 years or 3 years.
If I would have waited 6 months, it could have been much worse.
Exactly,
My
right?
lifestyle could have been different if I
Exactly.
waited any longer.
Yeah.
Yes.
So get your screenings. It's really important. If you have any questions about this kind of work, you can always go to our website at communitiesfirstinc.org, and we'll make sure to share these resources on our social media pages, things like that. But Dad, thanks so much for coming today.
Sure. Anytime.
Really appreciate it.
Anytime.
All right.